Good evening, everyone. Welcome to the Commonwealth Club's second virtual gala. I'm Gloria Duffy, President and CEO of the club. Thank you for supporting the club through another year in which we have provided trusted information and respectful dialogue on the many issues facing our society. The gala is the club's most important annual fundraiser. It enables us to present the hundreds of live-streamed and now once again in-person forums that we've been offering since the pandemic began, and to distribute them widely through the internet, radio, and podcasts. Our theme for this year's event is We Raise Our Glass to Good Health, which we have good reason to do here in the Bay Area as we gratefully mark one of the highest rates of vaccination and lowest rates of COVID in the nation. Tonight, we are honoring as distinguished citizens 8 outstanding women leaders in science and medicine. 7 of them are physicians at UCSF who've been on the front lines in preventing the spread of COVID and treating COVID patients. And one of them is a Nobel scientist whose research led to the first COVID vaccines. As a women-led organization, the club's chair is Evelyn Dilsaver, our vice chair is Martha Ryan, several of our vice presidents are women, and me. We are proud to honor the leadership of women in meeting the health challenges of this very demanding time. A big thanks to our gala co-chairs, Martha Ryan and Peter Hill, for their strong advocacy. Thank you to our sponsors who helped make this night a success. We are grateful and humbled by your support, and honored that you've joined us for this uplifting and inspiring evening. Now over to our MC, Diane Dwyer, a broadcast journalist for over 25 years at NBC Bay Area and KTVU. Diane is a 2-time Emmy Award winner and a faculty member at the UC Haas School of Business. Welcome, Diane.
Well, thank you so much, Gloria. Welcome, everyone. I'm Diane Dwyer, and I am so happy and humbled to be here. I am coming to you live from the club's headquarters here on the Embarcadero in San Francisco. It's a beautiful night, as it always is in San Francisco, and you must come back out. The club is now open, and there's so many wonderful things to do here, if not just spend a little time on the roof deck. So we wish you all were here with us, but we're going to have to wait a little while for that. We are thrilled to have so many people joining us from all over the country and the world. That's one nice thing about this virtual experience, is that we can include so many more people on the night. So thank you for being here. And our program tonight will be about an hour, just so you know, to pace yourself, and we'll feature the distinguished citizens and some special guests along the way as well. So as Gloria said, the theme of tonight's event is We Raise a Glass to Good Health. We celebrate 8 incredible women in medicine and science who have worked for the good health of the community. We also celebrate, of course, the good health of the Commonwealth Club. We love this club and what it gives to our community and the important role it plays in public discourse and civic discussion. It's a special place. So, you know, this is a fundraising event. In fact, it is the most important fundraising event of the year. We have a goal. We always have a lofty goal. We have $1 million goal today. Let's see how close we are to doing that right now, because we're keeping track and the numbers are changing literally as we're here. So right now, we're at $911,401. So we want to get to $1 million. We're very close, actually. And we have a match going on that we're going to tell you about as well. So we're at $911,401. Feel free to donate. Give generously. Give often. You can give a bunch of times tonight if you'd like to. Call your friends. Have them give, all for the Commonwealth Club. Your gift will go twice as far thanks to a matching grant of $50,000 by board member David Spencer. So big thank you to David. Thank you very much for doing this. Let's match that night tonight. We're going to do that, right? I will take on that challenge along with all of you. So one thing we're going to ask, make sure you have your glass of wine in your hand or water, whatever suits your fancy, because we're going to be making a lot of toasts tonight. The first one, we toast to you. Thank you for being here. Thank you for supporting everything that the Commonwealth Club does. And for, you know, wherever you are, at home, at work, whether it's midnight or it's, 6 o'clock, thank you for being here. Thank you for supporting the Commonwealth Club. This is what it's all about. We can't be together exactly, but it's pretty close. So on that note, let's learn how the Commonwealth Club makes a difference in this community and how you play an important role in that work.
Tonight, at the Commonwealth Club's virtual gala, we raise our glass to good health. And we also raise our glass to you, our members, donors, and audiences near and far. Thanks to you, the Commonwealth Club has been unwavering in its mission to find the truth and set it free upon the world. Thanks to you, we have hosted more than 700 virtual and hybrid programs promoting free speech, balanced perspectives, and respectful civil discourse from experts across the political spectrum. Thanks to you, we've brought forward critical discussions about public health. Scientists, physicians, community leaders, government authorities, and policymakers from around the country were all brought to our platform to keep the community informed about how they could stay safe throughout the pandemic. Thanks to you, we've amplified diverse voices and perspectives from across our community. Thanks to you, we've inspired more than 500 students to be civically engaged leaders of tomorrow, engaging them with programs created for them and with them. Thanks to you, the Commonwealth Club offered all 2020 and 2021 high school and college graduates a free one-year membership to the club. Thanks to you, we've reached an ever-expanding global audience across borders, boundaries, and time zones. Our virtual programs and podcasts now have an even broader global impact. Thanks to you, the Commonwealth Club is more essential and relevant to the community than ever before. And thanks to you, we are ready and able to welcome you back to our beautiful and safe building by the bay. Once again, we can commune, discuss, learn, and be together, in person. Join us soon at the Commonwealth Club, and we'll raise our glass to you.
Thank you so much. And in case you didn't know, I told you just a little bit ago, but the club is officially open. So many people are back enjoying the club's programs, this beautiful building. I love this building. I love the rooftop. And if you haven't been here recently, there's a new sculpture exhibit that's pretty fantastic as well. So tonight may be a virtual event, but next year, we are going to be in person. Our Gala 2022 will be in person in this beautiful building. So we look forward to welcoming everyone back as we get back on track here. So for tonight, though, I am pleased to announce the 2021 Distinguished Citizens, 8 women who have devoted their lives to the health of millions of Bay Area residents and honestly to the world. So please grab your glass, raise your glasses to Dr. Jennifer Doudna, Dr. Kirsten Bibbins Domingo, Dr. Kim Rhodes, Dr. Monica Gandhi, Dr. Diane Havler, Dr. Margot Cushell, Dr. Karina Marquez, and last but very not least, Dr. Alicia Fernandez. Cheers to each of them and to their good health. We're going to get to hear a lot about them coming up in just a little bit, and we have some surprises too that I think you'll like. So before we learn about these truly remarkable women, we'd like to thank our many supporters and sponsors who have given so generously to the Commonwealth Club. Thank you so much. At the marquee level, we have Devin and Pete Brigger. We also have Eric and Wendy Schmidt, and David Spencer and Senspa. Those are all at the marquee level. Thank you, thank you, thank you. And next up, at the next level, we have our hero level. Pitch and Kathy Johnson and Arthur and Tony Rimby Rock. Thank you so much at that level. And we have our leader supporters. Adobe, Baylord Foundation, the Chan Zuckerberg Initiative, the John and Marcia Goldman Foundation, UCSF and Dee Dee Wilsey, and 3 anonymous donors as well. Cheers to their good health. We'd also like to recognize more than 200 donors, getting us to $905,000 so far tonight that we started at and counting. So, are we ready? Look at all these beautiful people and companies that have supported the Commonwealth Club. Let us raise our glass to each one of them, all of these sponsors, champion level, presenter level, thank you for making a difference. Thank you for giving back to the Commonwealth Club that does so much for our community. And don't forget about our matching grant of $50,000. So please give now and help us reach that $1 million mark, because if you give $1, the Commonwealth Club gets $2. So that's worth it in and of itself. So right now, with a little drum roll, we're now at $913,224. So that's where we are so far. We're closing in on the $1 million mark, but we have a little ways to go. So honestly, I promise not to be offended if you move off the screen a little bit in order to grab that credit card and donate to the Commonwealth Club. That's okay with me and with all of us here at the Commonwealth Club, we promise. So we do have a very exciting and educational lineup tonight, starting with 3 of our awardees and a greeting from a very special friend of the club, a household name, I think you've heard of him, Dr. Anthony Fauci.
Warm greetings to you all. My name is Tony Fauci, and I'm the director of the National Institute of Allergy and Infectious Diseases and the chief medical advisor to President Joe Biden. I am delighted to extend my enthusiastic congratulations to all the extraordinary women being recognized by the San Francisco Commonwealth Club this evening for their scientific and medical leadership during the COVID-19 pandemic. Dr. Jennifer Doudna's Nobel Prize-winning breakthrough on the CRISPR-Cas9 gene editing system has not only revolutionized molecular biology, it also has wide-ranging potential in the treatment of human diseases. Results from her laboratory published just a few weeks ago described SARS-CoV-2 virus-like particles, or VLPs, as new tools to safely study the properties of more transmissible variants. Using these VLPs, her work showed that mutations in the nucleocapsid protein allows the Delta variant to package its genetic material more efficiently, potentially explaining its high degree of transmissibility. Also being honored tonight are 7 female physician investigators who have been on the front lines caring for their patients amidst the many challenges presented by the COVID-19 pandemic. Kirsten Bibbins Domingo, Alicia Fernandez, Monica Gandhi, Diane Havlier, Margot Cushell, Karina Marquez, and Kim Rhodes. I have known several of these remarkable women for many years through our shared dedication to ending the HIV epidemic, both in the United States and abroad. As I read the biographies of the honorees, I was struck by a common commitment to understanding and combating health disparities, reaching underserved communities, and mentoring the next generation of a diverse scientific workforce. All of these are core values necessary for a successful pandemic response. Soon after the pandemic began, these women pivoted their research to study various aspects of COVID-19 in the communities with which they work, including ways to deliver much-needed diagnostic testing and vaccination resources to the underserved. And so, my heartfelt thanks and congratulations to each of you on your exceptional achievements. Your contributions to science and the health of your communities have no doubt contributed to the successful COVID-19 response in the Bay Area and serve to inspire scientists and clinicians everywhere. Stay well and continue your extraordinary work.
I am Alicia Fernandez, and I am a professor of medicine at UCSF.
I'm Monica Gandhi, and I'm a professor of medicine and infectious disease doctor at UCSF.
I'm Karina Marquez. I am an assistant professor of medicine at University of California, San Francisco, and at San Francisco General Hospital. I'm also an infectious disease doctor and one of the leads and co-founders of the Unidos en Salud collaboration.
all of us who are here today are partly motivated by the same thing, seeing health as something that everyone should get to aspire to. And that's part of the essence of public health. And what we've been doing is probably best thought of as public health.
Every day I get up, whether I go into the hospital, whether I go into the clinic, whether I'm working at the vaccine site or testing site, being able to serve and to promote health within the community and with my patients is what brings me to work every single day.
I came to San Francisco deliberately, actually as a resident, because I was interested in HIV and I was interested in social justice. And I thought that San Francisco was a place that focused on disparities. And I've been really profoundly moved by some of my colleagues and the ones that you are honoring today. Thank you so much. So the early days, I remember that we all gathered the day that the first case of community transmission was reported in San Francisco on March 5th, 2020. We were all gathered holding our breath to see if that was a case that was imported or it was a community transmission case. And we knew that day that it would spread. It would spread in the city of San Francisco.
I remember the beginning when we saw our first patient with coronavirus. I remember being faced with, oh my goodness, this is a disease I have never faced before. We didn't know much about the treatment. We didn't know much about the epidemiology. Trying to figure out where we can go next in terms of clinical medicine and public health was this initial challenge.
We saw that 80% of the patients in our hospital were Spanish speakers. And that's not normally the case in our hospital. Our hospital at San Francisco General is very diverse. And here, not only were they Latinos, but curiously enough, they were Latino immigrants. And it was really moving to see how sort of personally people took it and how people felt that we needed to act.
I remember back at the beginning when the first patient with coronavirus came into the hospital, all of the infectious disease team, doctors, we gathered. We had to immediately jump into action, decide infection control protocols, testing protocols, treatment protocols. And this was in the face of not really knowing much about this virus yet. But we drew on our knowledge of other infectious diseases and were able to put things into action.
I grew up in Argentina at a time of great tragedy. I was a teenager during the military coup. And in fact, I went to medicine because of the HIV epidemic. And it wasn't until the HIV epidemic when I became aware, oh wow, medicine is actually about who gets sick, who gets healthy, who gets healthcare. And during my career at UCSF, I've focused on health equity research. I focus on language barriers and communication.
It was really HIV that led to what's called the parallel track process, where we get through medications and vaccines more quickly. It was all HIV activism that said to the FDA, you can't take a long time, you have to hurry if there's something life-saving. That fundamentally helped the EUA process happen and vaccines happen more quickly. You meet people where they are, and that's harm reduction. What I learned from HIV is that you don't shame people, you don't stigmatize people, you don't say something's wrong with you that you got COVID, you weren't being safe enough.
This is the time to really make sure that people are not left out because of who they are as poor people, as marginalized people, or as immigrants.
The time where we opened our first community vaccine site and delivered the first COVID-19 vaccine to community members that came, and being there and shifting from testing in response to prevention made me excited.
I did work a lot on school openings and worked a lot on the impact on children of school closures, even in the setting of a COVID pandemic, because there were ways to keep children and teachers safe. And the day that schools opened in San Francisco on August 16th, 2021, I was so happy that day.
The day that I realized how high the vaccination rate was among Latinos in San Francisco, because that high vaccination rate, and I think it's one of the highest in the country, is really the result of so many people's work, that we created so many opportunities for vaccination, so much education around vaccination, but also a feeling we mitigated so much of the mistrust that people naturally feel when having to go up and give their name and get vaccinated.
We spend a lot of time talking about healthcare disparities and interventions to address them. And I think one key intervention to address disparities is diversifying the healthcare workforce, whether it be increasing women, especially within leadership, as well as diversifying the healthcare workforce. Right now, only I think fewer than 5% of physicians are Latinos, and we make up over 30%, up to 40% of California.
There's no doubt in my mind that without diversity, the UCSF response would have been different. This is where diversity at UCSF has paid off. It has allowed groups of leaders to emerge, to work together, and coming from different perspectives, and to make us stronger as a result.
Hello, everyone at home. I am Martha Ryan, incoming chair of the board of the governors of the Commonwealth Club, and also co-chair of tonight's virtual gala.
And I am Peter Hill, co-chair of tonight's event and executive chairman of Baylor. Martha and I are here at the club's headquarters on the Embarcadero, where we are live streaming our gala to you and audiences far and wide.
That is right, Peter. This is our second virtual gala, and as you can imagine, planning a special event like this was a little tricky this year. However, we look forward to 2022 when we hope to host a grand gala event in this beautiful building once again.
Martha and I represent the Gala Committee, a group of dedicated volunteers who have helped plan tonight's program. When we put our heads together, Martha, it's remarkable, it was over a year ago, we knew that we must recognize the heroes in science and medicine that have kept our community safe and healthy.
Yes, indeed, Peter. As Dr. Fauci, who is so incredible, just said, these 8 amazing women deserve our congratulations and our gratitude. We can raise our glasses to their good health that they have provided to so many.
And as much as we celebrate them, we also celebrate the Commonwealth Club for its unwavering service to the community.
That is right again, Peter. Tonight is a fundraising event after all. We are so lucky that the Commonwealth Club exists to keep us informed and connected. And we need to ensure that the club exists for years to come. And that is why it is so important that we reach or surpass our goal of $1 million raised tonight. And the exciting news, and this is indeed exciting, every dollar that is raised tonight will be matched 1-to-1 up to $50,000 by David Spencer, a board member of the club and a very dear, dear friend of mine. Thank you so much, David.
Wow. Please help us meet this matching grant. You can give a pledge now by clicking the button on your screen. Every dollar counts. So please, please give generously and help us reach our goal and support the vital work of our club.
And now, let's hand it back to our wonderful MC, Diane Dwyer, who I've known for so many years, to learn more about our honorees. So cheers, Peter, to your good health.
And to yours, Martha.
Thank you.
Thank you, Martha and Peter. Here's a little secret. I've known Martha since I was about that big, just in case you didn't know. Thank you, Martha. So fun to see you, and what a beautiful view up at the rooftop of this building. So Martha and Peter have worked tirelessly to make this happen tonight, but they also have a group of volunteers supporting them as well. So let's do a quick toast to the members of the Gala Committee who have worked so hard to pull off this virtual gala, which in some ways is harder than the ones in person. So thank you to the Gala Committee and to Martha and Peter Peter for all of their work. There's our names of the folks of our gala committee today. And we also want to check in on our fundraising, right? Because this is, as we mentioned, a fundraiser. So let's check. We are at $931,275 and counting. So thank you. Thank you for donating. Continue to give generously. And just so you know, on the match side that Martha was just talking about, that we can go up to $50,000, we're at $27,896. So the next folks who come in, they're going to be giving $1, and the Commonwealth is going to be getting $2. So this is the time, if you're thinking about donating, this is the time to do it. Push that little button on your screen and make it happen for the Commonwealth Club. Please give generously. Keep the wine, the water, whatever makes you happy flowing as well, so that we can continue to have a lovely night tonight. All right, so what's up next? We want to celebrate 2 more of our distinguished citizens. We're also going to get to hear from Sam Hawgood, who's the chancellor at UCSF. And remember I said there were going to be some surprises? Well, we had Dr. Anthony Fauci there, and now we have another surprise, a musical performance by Dr. Charles Lim. He happens to be not only a talented physician, but also a very, very talented musician at UCSF. He has an original piece called Catalyst, and he actually performed this for the Chancellor's State of the University address at UCSF just a couple of weeks ago. Listen in.
I'm Kirsten Bivens Domingo. I am a physician at San Francisco General Hospital. I am a professor of medicine and a professor and chair of the Department of Epidemiology and Biostatistics at UCSF.
My name is Diane Havler, and I am a physician and researcher. I am a professor at UCSF, and I am the chief of the Infectious Diseases, HIV and Global Medicine Division at Zuckerberg San Francisco General Hospital.
Many who are doing this work took it on because of the importance of the work full force. But 18 months is a long time, so I think we're all tired. But I have found ways with my family to figure out how to balance and to try to realize that this is not a sprint, it's a little bit more of a marathon, and to try to balance in that way.
This is something that we didn't do at all at the beginning, and then when we hit the point of exhaustion, we realized that we did need to rest. And so what we've done is made commitments to each other that we will take breaks, we will cover for each other so the work goes on, but we can get refreshed and renewed, because that's the only way we can continue with this pace that we need to keep up in the response to the pandemic. When this pandemic came, we noted, the doctors in the hospital, that 80% of the people who had serious COVID were Latino. Now, normally in our hospital, that is about 20 to 30%. And we knew that the people who were being admitted to the hospital were just the tip of the iceberg of this pandemic. So what we needed to do, and what we pivoted my research group to do, was to ask the question, what is happening in the community? How is the virus being transmitted? Who are the people that are most being infected, and why?
I'm particularly focused, both in the clinical care as well as in the research that I do, on caring for more marginalized populations. Usually those populations who might have fewer resources to take care of themselves in a pandemic, and communities with fewer resources. And those are the ones before the pandemic who we knew were more at risk for many of the health problems. It was pretty clear once the pandemic started that this was going to be a story not just about a virus, but about also the communities that are disproportionately affected. My research has actually pivoted to also include how we understand who has really borne the brunt in California, which communities have died in excess of what we'd expect in any other year. What do we learn about education, about race and ethnicity, about income levels, that really help us to understand what puts people at risk to have these very high rates of disease and death during the pandemic, so that we can target our public health responses more effectively.
San Francisco and the Bay Area has been a model of what one does in a pandemic response. There was a purposeful emphasis on equity, and there was a purposeful emphasis on reducing disparities.
We have benefited from really outstanding decisions. The public health officials working in partnership with many of my colleagues at UCSF, with the other hospitals, and most importantly with community members to figure out. And I would say it's not been perfect. Nothing is perfect, but I think that there has been a constant recognition that we're going to need to partner, we're going to need to communicate effectively. We're going to need to use the data to understand when we have to pivot and make a new decision.
We reached out to an organization that had already been formed called the Latino Task Force, and this is a consortium of Latino groups in San Francisco who were organizing behind food insecurity, housing, all the challenges had to come up. And what we realized was that we had a common agenda to generate data and to provide services to help the community.
Several things made me realize that it was going to be important for me to also take on a larger role here. One is, I'll be frank, I saw mostly men on the screen communicating, and I think that this is a pandemic that affects everybody, and being able to have more people and voices on the screen was going to be important. The second is that the deep inequities of who was being impacted by the pandemic was never a focus in the main narrative of the pandemic, particularly early on. And as somebody who's a physician and an epidemiologist, being able to talk not only about the numbers overall, but also the disproportionate impact was going to be really important. And that's something I wanted to bring to that narrative.
People trust leaders of their social networks. We need to empower people in the community. And at our vaccine site that we have in Unidos and Salud, we activated a program where while people were in the waiting area of the vaccination, and about 80% of the people that come to our site are Latino, we invited them to become a vaccine ambassador. We said, pretty much everyone knows someone who hasn't been vaccinated. What does that feel like? Would you be willing to talk to that person? And I think this is another really important part of communication.
I'd like to see more women in leadership roles, more diverse people with diverse backgrounds in leadership roles, because it's ultimately not just getting more people in the door, but also making sure that our institutions and the leadership of our institutions reflect exactly the values and commitments and the types of communities we want to be serving.
We bring together diversity in gender, in ethnicity, in perspectives on life. And people who seek healthcare, they need to see people who look like them. They need to see a diverse workforce. And health requires all sorts of different kinds of expertise. And we are better equipped to provide that healthcare when we have a diverse workforce.
The key to pandemics is to understand that equity is our moral responsibility, our ethical responsibility, our societal responsibility, but it's also the only way we get out of the pandemic is to really understand that we're all connected and that we really have to understand those who are most vulnerable among us and design our systems to make sure that we address the needs there as well.
Good evening, everyone, and thank you for the opportunity to participate in the Commonwealth Club of California's annual Distinguished Citizens Gala. We are so proud that this year's awards recognize 8 phenomenal leaders from our UC community who have distinguished themselves with their contributions to our society's response to COVID-19. The leadership these extraordinary women have shown in health and science represent the very best of the University of California's commitment to public health and public service. We are proud to work with them in serving the health needs of our communities, driving research and ensuring access to vaccines, testing, and care, especially for the most vulnerable among us. So on behalf of the entire community at the University of California, San Francisco, my congratulations.
Wasn't that spectacular? Music has so much power to inspire and to heal and to change how we perceive things. I can't thank Dr. Lim enough for sharing your talents with us. I'm feeling talentless, doctor and musician. It's a little overwhelming. And all these doctors who are doing so much, giving back during this time of this pandemic and making a difference for these underserved communities is just incredible. So on that note, let's look at our fundraising total because we are still fundraising here as well. And right now we have $934,020 donated so far. We're closing in on our $1 million mark. And for the match, we're at $30,000. So we have $20,000 more on that front. And on that note, let's bring up Kimberly Moss. She is the VP of Development. Kimberly, hello.
Hi, Diane. It's nice to be here with you.
Oh, so nice to see you. Absolutely. Okay, so tell us what's going on.
We're at $30,000 of that $50,000 match. So we have another $20,000 to go, and I think we're going to get there.
You have faith?
Yep. Thank you, everybody out there.
But we still have to get people to keep donating. So click on that little button, call your friends, click on the button a couple times if you want to, right? That's all good. Okay, can you fill us in a little bit? We've been talking about other things going on at the Commonwealth Club, the doors opening up. Fill us in.
Yeah, the club is open. Everybody, please come visit us. We are doing virtual events, but we're doing in-person events, and we want to see you here. In fact, on December 10th, we have a holiday social hour with music, an art exhibit, maybe even some dancing.
Nice. Dancing performances, dancing for us.
Maybe both.
Okay. All right. A little kick up our heels a little bit, do a little dancing. Okay. So that sounds wonderful. Thank you for sharing. Kimberly's keeping track of the money as it's coming in. So we'll have more updates throughout the night as well. Thank you for all your hard work tonight, making all this happen.
Thank you, Diane.
Absolutely. All right. So now it is time to raise your glass yet again. Here we go to two more distinguished citizens.
Margot Kuchel. I'm a professor of medicine at UCSF, where I direct the UCSF Center for Vulnerable Populations and the UCSF Benioff Homelessness and Housing Initiative. You know, I'm doing okay. I'm tired, I think like a lot of us are. I'm grateful that my family is safe and okay, and feeling grateful for all the people I've had the chance to work with. My work is almost exclusively on issues related to the homeless population. The first few days after shutdown, I was invited to come up to the State Emergency Operations Center, where I spent some very intense time period in a small room. In retrospect, it's kind of funny because we were all in there without masks for like 18-hour days with a few leaders from the state and a leader from HUD, trying to design a response to what we knew was going to be an enormous crisis for people experiencing homelessness. So in those first few long days, we really drew up the game plan for Project Roomkey, which is, I would say, the first way that my team was involved. With the tourism industry collapsing, there was a recognition that there was suddenly all of these empty hotel rooms in an industry that really needed funding and help as well. And we really knew that we didn't have enough rooms. We were never going to have enough rooms to offer safety or non-congregate shelter to everybody who needed it. So we designed a program that had a few principles. We prioritized the services to people most at risk of dying or requiring hospitalization were they to get COVID, knowing that we couldn't bring everyone in. And then the other use of it was for what we called isolation and quarantine, so that there could be a place people could go and receive care and not require hospitalization at a time when we knew our hospitals would be already overburdened. I think we had incredible leadership from our departments of public health. We have a population that believes in science, that has a bit more of a communitarian aspect, long-standing partnership in the Bay Area between universities and public health departments. It goes back really to the HIV epidemic from the early days of this partnership, I think has really also set us up well to work together in crises to try to get us to a better place. We certainly need more women in leadership roles, but I would say the real burning fire or the real urgency is to make sure that medical professionals come from the communities that we serve, look like the communities that we serve, and that we really talk about true diversity, equity, and inclusion across the board so that people can receive healthcare and can receive messages from people who come from their own communities.
I'm Kim Rhodes. I am an associate professor of epidemiology and biostatistics, although I'm trained formally as a general and colorectal surgeon. And I'm also the associate director for community engagement for the UCSF Helen Diller Family Comprehensive Cancer Center. And I'm the founder of Umoja Health. I'm feeling much like I've felt a lot of this last 18 months, which I would say is sleep deprived. But at the same time, I'm also feeling hopeful because I think we're in a good position. I think we've learned a lot. In the early days, I feel like I got advanced warning because sitting in an epidemiology department during my annual review in 2020, my division chief, who happens to be an HIV epidemiologist, started onto a conversation about COVID. This was in March, first week of March 2020. And he talked about how to manage a pandemic and that we have a playbook for this and that we should be social distancing. And this was the first time I had heard that term. And I remember being really impacted by that conversation. And I also had, in that same week, a meeting with one of our community partners, because my job really is developing community partnerships around cancer. And we were talking about the planning of Carnival, which happens in the Mission every year for the last 40 years. And I remember thinking, Carnival is going to get canceled. And then as the weeks wore on, it became very clear that we were going to be on lockdown. There would be no Carnival. And so my staff was starting to get requests from our community partners about information on COVID rather than information about cancer. And so we completely pivoted to delivering COVID information. We started a little newsletter that we sent out where we tried to aggregate any information that was coming from UCSF in any language or for any particular community into one newsletter, effectively about what's happening with COVID. But as we're compiling this, I was recognizing that there was nothing there for African American people specifically. And so that really motivated our continued work in COVID and our commitment to focusing on the African American community. I'm really motivated now by what we've created with Umoja Health, the networks of people that we work with, how energized they are to really have an impact in the African American community around COVID. And that's what keeps me going. After a certain point of doing pop-up events for testing in the African American community with community members, setting up the tents, serving as line registrants, keeping people socially distanced. What I started to see was that people were learning about COVID through participation rather than through us lecturing to them. And several African American men approached me separately, independent of each other, to let me know that this was the most meaningful work that they had ever done in their lives. So seeing that and then getting that feedback made me realize we're doing exactly the right thing. And then we've had several folks head off to or start their applications for medical school, people who are underrepresented in medicine, and they're writing their essays about Umoja and about that work because it is so meaningful to them. This is a contribution to generational wealth in the African American community. And so those are the moments, like when you could see that big realization for somebody that, oh, this is changing the direction of my life. This is changing what I want to do with my life and how I want to lead my life and what I want to leave to my children. And those have been the most, I think, inspiring moments of this work in this pandemic.
I'm Dr. Grant Colfax, Director of Public Health here in San Francisco. Thank you for tuning in to this very special event. And thank you, Kim and Margot, and your colleagues. You have done remarkable work, and I'm delighted to add my congratulations tonight. Your leadership and expertise has been key to our city's COVID-19 efforts, ensuring that San Francisco led with data, science, and facts, and that our response was driven by equity and partnership. I couldn't be prouder of the Bay Area's healthcare heroes, those of you who have tirelessly and resiliently worked day after day under considerable strain and uncertainty to take care of our city and region. I celebrate the 8 remarkable people who are being recognized as distinguished citizens tonight. I toast your hard work, your courage, and your spirit of partnership with San Francisco, which has been truly invaluable and which has saved so many lives. Thank you, doctors.
Good evening. I'm Carolyn Weisinger, and I'm the Education Coordinator at the Commonwealth Club. Education has always been at the core of what we do. For 118 years, we've brought together people on the principle that a community of thoughtful, educated citizens empowered to speak up and take action on issues that matter is the best way to ensure a healthy and democratic society. In 2020, we expanded this commitment with the launch of our civics education initiative, Creating Citizens. During the pandemic, our virtual programs have been supported remote learning by giving students and educators direct access to the leaders and thinkers who are shaping our world today. Through programs such as After the Capitol Siege, the Need for Civics Education, and Building an Anti-Racist Classroom, we've brought scholars, educators, and civic leaders from across the ideological spectrum together to dive deep into complex, often controversial, and always critical contemporary issues. Our Youth Talk series brings students into the conversation too. With programs like the right to vote at age 18, Gen Z, and the fight against voter suppression, illuminating young people's perspectives and giving all of us a preview of the leaders who will be shaping our world tomorrow. And to ensure that all youth, no matter their backgrounds or circumstances, can learn from these powerful resources, we provide special access for underserved educators and students through our Ideas Inspire initiative and partner with schools and youth service organizations throughout California and the U.S. In these polarized and divisive times, it is more critical than ever that we give our youth the tools and opportunity to participate in our democracy. And we need your support to continue this vital work. If you donate now, your support will be matched one-to-one by a $50,000 matching grant. Please help us serve even more students and youth in the year ahead. Thank you.
And thank you, Carolyn, for sharing how the Commonwealth Club is engaging students. Again, the funds raised tonight will help support these terrific educational programs that Carolyn was talking about. So thank you for sharing that with us, and to the distinguished citizens who are giving back in so many different ways and sharing their stories with us. It's pretty incredible. Okay, so let's check in. We are still fundraising here, and we're closing in on the $1 million mark. Right now, we're at $944,390. So we've got about $50,000 more to go to hit our $1 million mark. So we got to get busy, and we got to motivate you for sure. And just so you know, our match is at just a little above $40,000. So the next $10,000 donated will double that to 20. So if you're thinking about donating, now's the time before that doubling, that matching opportunity goes away. We've got $10,000 more available for the match. And our night is not over by a long shot. Our final distinguished citizen has been widely recognized as a scientific pioneer in health. In fact, she won that prize. What's that prize? The Nobel Prize in chemistry. So the winner of the Nobel Prize in chemistry, please raise your glass with me to all of them and to the good health of Jennifer Doudna.
Hello, my name is Jennifer Doudna. I'm a professor at the University of California, Berkeley, an investigator of the Howard Hughes Medical Institute, and a senior investigator at the Gladstone Institutes at UCSF. I'm also the proud founder and president of the Innovative Genomics Institute at UC Berkeley and UCSF and the Gladstone. The group of distinguished citizens and visionaries that you are celebrating tonight is remarkable. I'm honored that you have selected me to be among them. The Commonwealth Club's role in elevating debate and understanding around public policy and societal change has itself been visionary for more than 100 years now. I salute your impact. Genome editing and CRISPR technology in particular is most fundamentally about science. At the same time, we are in the midst of a revolution in the way that biological sciences are transforming our lives. And the revolution has just started. Humans suffering from diseases such as sickle cell anemia, cystic fibrosis, and Huntington's will be behind us in a generation, and likely sooner. Daily, as we work toward advancing the basic science, we also work toward translating that basic science into greater impact, which is, after all, one of the raison d'etre of our great research universities. The work of my colleagues at UCSF that you are also honoring tonight is well known to me. More broadly, the global scientific community has pulled together to fight COVID-19 in unprecedented ways, as have many of you in this room through your support for research or for policy advance that support science, or for helping the people around you that appreciate we are all in this together. My thanks to all of you tonight. CRISPR technology has been intimately a part of our response to the COVID-19 pandemic, both through its utility as a diagnostic tool and as its potential in the future to operate as a therapeutic. Fundamentally, CRISPR is an immune system in bacteria. So harnessing its capabilities in the face of this pandemic makes a lot of sense. Certainly for science, it's made us reflect on why we do our work and how we do our work. How can we work most effectively towards the kinds of discoveries and applications of technologies that will have real impact in the world. I think for me personally, it's been an opportunity to revisit the role of collaboration and teamwork, something that we sometimes get right in academic science, but I think has really, for me at least, been a joy of working with colleagues during the last 18 months is the opportunity to really team up to do science that would have been impossible to do or impossible to do quickly without a team of people aligned in their interests. And I hope we can maintain that kind of momentum even as we move away and out of this current pandemic. This was an important reason I founded the Innovative Genomics Institute. The idea is to bring the CRISPR technology to bear on real-world problems, whether they be in healthcare or in climate change, and to do so with an eye towards making the fruits of that labor available to everyone globally that can benefit from it. It's a tall order, but it's a really exciting challenge, and I'm excited to be working with many brilliant colleagues on this problem. The Nobel Prize for me was a combination of a complete shock and an incredible honor and recognition of the teamwork of our group of scientists who collaborated to work on CRISPR-Cas9. I think it's amazing how inspirational a prize like this can be, especially to people who have felt perhaps excluded or underrepresented in the STEM fields. I've been honored to talk to many, many students, especially in the last year, who felt inspired by the award of the Nobel Prize, which happened to go last year to 2 women who had collaborated on this work. My advice for aspiring scientists is to, first and foremost, to follow your passions, follow what excites you in science. That's what I've always tried to do. Secondly, I advise everyone to look for opportunities to work with the best people and to find mentors who will support your vision, even when there are many naysayers. I've had to deal with lots of people in my career who have said that idea will never work or that experiment is a failure. And to find people who are supportive in those moments is really helpful.
First of all, I'm so proud to be included in this group. This powerful group has been an incredible force, not only on the ground, but also in the thought process around how to approach what needs to be done.
I am deeply honored to be recognized as a distinguished citizen of the Commonwealth Club.
I'm so honored for the recognition and so honored that the Commonwealth Club has recognized this great group of women physicians who have been working, I think, tirelessly throughout this pandemic, and so really appreciate the honor.
I've been a resident of California for 20 years, and I could have never imagined this moment. It's also great to be a part of the incredible group of scientists who are recognized this year.
These are my friends and colleagues, and they're women, and I really thank the Commonwealth Club for recognizing the role of women in this pandemic in this city, because they have really had been powerful voices.
I'm very proud, but also it means a lot to me because in medicine, it's all important. Discovering the science behind the vaccines is important. Making the vaccines is important. Giving the vaccine to an individual patient is important. And the public health we've done by making vaccines available and educating people around the vaccines is also important. Because the Commonwealth Club is so distinguished, it's such an important institution within San Francisco, it feels to me as though San Francisco is saying, hey, great job, you belong here.
Just to be recognized by an organization like the Commonwealth Club, which is a place I've always looked up to. You know, when I moved to San Francisco and I didn't know that many people, I would come down to events in my free time, even as a resident, and learn so much about the world and the community. And I'm always impressed by the level of discourse, people who can disagree with one another, but learn from one another and listen to one another. So I think it had a particular resonance that it's from the Commonwealth Club.
The Commonwealth Club is recognized as such an aggregator of reach across so many different sectors of the population, right? From the lay public all the way to the most esteemed scientists and researchers and thought leaders. And so to be included and honored as a part of a group that is felt to be thought leaders is just simply overwhelming.
All of us, I think I speak for when I say that we appreciate the role of the Commonwealth Club in supporting the policies and education that make it possible to do our work and to make science more broadly available to society.
I'm so honored and humbled by getting this award. Also, to receive this award with all these incredible other women, physician, and scientists.
Dr. Bibbins-Domingo, Kirsten, my boss, my department chair, is just a force of nature, and I feel incredibly fortunate to not only to be working in her department and to be in this pandemic under her leadership, but also to get an opportunity to observe the way that she leads.
It's very moving to be honored with colleagues who I really respect and admire.
Women in the city have really worked hard, and I really thank you all for honoring these great women that are so important.
Isn't it inspiring to celebrate these 8 incredible women who are making such a difference in our lives every day, to hear about their work and the camaraderie? I love that they're working together. That's what this is about. And speaking of working together, you all are working together with us as well to raise money for the Commonwealth Club. And we have a big announcement to make. So, Kimberly Moss, come back up and tell us, what do we have? What's the news?
Okay, Diane?
Yes?
We met
Drum
the match.
roll.
We met.
There we go. We met the match.
We met the match. We met $50,000 raised. Thank you so much to David Spencer, board member, for making that matching grant. And thank you to all of you for helping us meet that match. Thank you.
Well, congratulations. That is terrific news. We're not done yet, though. We still have to get to the $1 million mark, right? So we're at $971,366, about $30,000 more to get to our goal of $1 million. Can you help us? Can they help us?
I think so.
Yes. Okay. Thank you tons, Kimberly. Thank you for the up-to-the-minute live report on what's going on with our fundraising. We are nearing the end of our program, but we're not done just yet. We have one more guest. If you've been thinking about traveling a little bit, I certainly have. It might be time to dust off that passport and think about hopping on a plane. So let's hear from Christina Namath, that is. She's the travel director for the club. Christina, tell us what's going on.
Good evening, everyone. I'm Christina Namath, and I'm the Director of Club Travel. The Commonwealth Club has been running educational journeys for our members since the late 60s, exploring the world with the mission to learn about other people, perspectives, and cultures. Our trips have excellent local guides and guest speakers who provide insights along the way. We encourage discussions with lecturers, local people, and of course with each other. We like to think that we travel in the Commonwealth Club's spirit of curiosity and listening, and having informed discussions about things happening today. One of the best parts about our trips is experiencing it all with other club members who are engaged, interested, and interesting. We've stayed closer to home these past 2 years, but are excited to be offering an extensive variety of programs in 2022. Next year, we hope to have trips all over the world, from Japan to Israel to the Panama Canal. Whether you want to join a walking trip in France or a safari in Tanzania, we hope to have something for you. I invite you to take a look at the travel section of our website. We follow the highest safety protocols and health recommendations. All travelers and tour staff are fully vaccinated and will keep you informed of the latest requirements and make sure to facilitate any testing in the destinations visited and for your return home. We hope that you'll travel with us when you are ready to do so. We also have been operating domestic outdoor programs this last year and will again next year. to places like Alaska and Death Valley. We have trips that dive deep into our country's history, like our Native American Voices program and our trip to the U.S. South, looking at the Civil Rights Movement. Your generous support of our gala allows us to offer scholarship opportunities to college students on these programs. Give now by clicking the button on your screen. Thank you for being part of the Commonwealth Club community, and I hope to see you here at the club or on one of our trips.
I'm counting on seeing you on one of those trips, Christina. What a wonderful way to see the world again and in the good company of Commonwealth Club members. That is the perfect way for us to start traveling again and supporting the Commonwealth Club at the same time. Okay, so we want to check in. We're so close to our $1 million mark. Right now, we're at $996,391. Okay, so we need about $4,000 more in these last few minutes in order to reach our goal. We had a couple of big donors right there. So thank you for giving. Thank you for giving generously. If you want to just, get us over that mark, that would be really great. We have come to the end of our program, but we do have a few more thank yous to do, a few more things. So thank you for a beautiful and successful evening. I'm not going to leave actually until we get over the $1 million mark, so you may be stuck with me for a while. We're going to thank everybody who gave, and especially David Spencer, our board member, who gave the $50,000 matching grant. That was a huge difference that really made a difference for all of us here and for the Commonwealth Club. So we also want to thank some group of funders who have made extraordinary contributions to the club's reopening campaign, because getting this place reopened again wasn't easy either. So these funds are helping the club restaff and reopen after its period of closure. Thank you for your generosity, all of these groups, for giving back to the Commonwealth Club and helping us get back on track. Thank you for keeping these doors open once again, because that's why we're all here and that's why we love this Commonwealth Club so much. So again, we're still at $996,391. So we've got to get to that next spot. Is somebody thinking about it? If you're sitting next to somebody, kind of nudge them, say, it's now time. We've got to get to the next place, right? Okay, so what else do we have going on? The biggest thank you of all, we have a big thank you to the 2021 distinguished citizens, right? The doctors, the scientists, the community members who are giving back to our community in such an incredible way. They are what we're here for. They are why we are raising our glasses and saying to good health tonight. So before we go, and before we see those numbers roll up here, I'm going to just top off my glass a little bit. Whether you're doing water or wine, whatever you like, we're just going to top off our glass and we're going to say a final toast. Let's raise all our glasses. Glasses raised wherever you are, what time of day, from the Commonwealth Club here in San Francisco to each one of you at home, abroad, wherever you happen to be, to good health tonight. So from all of us here, I need to take a sip if I do a toast, right? So I need to do that. Okay. Maybe that'll be our good luck to get the numbers over. So from all of us here at the Commonwealth Club, thank you so much for giving back. Thank you to these wonderful women who have made a difference in our community and honestly throughout the world in the work that they're doing. We will see you next year in person here at the wonderful Commonwealth Club on the Embarcadero. Are we going to make it over the $1 million mark? I'm just waiting for that. I'm hoping that's going to happen because I've heard that. Okay, did you hear that? Kimberly just yelled out to me that there's an anonymous gift of $25,000. That does it for us. Woo! We made it. We got over the $1 million mark by a lot. So thank you to that anonymous donor. Otherwise, you would have been hearing me talk here forever and ever and not get rid of me. So congratulations. We made it over the $1 million mark. We're helping the Commonwealth Club and we're helping our community, which is what we're here for. Have a wonderful night. We'll see you next year in person here at the Commonwealth Club. Good night.
To good health.
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 Here's to the club's members and attendees, and to your good health, one of the best blessings of life.
To good health.
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 To good health. To good health.
To good health. To good health.
To good health. À votre santé. L'chaim.
To good health.
A toast to good health.
To good health.
To good health.
To good health. To good health. To good health.
To good health.
To good health. Satay.
To good health. To good health.
We've had a lot of toasts tonight, and this one is the most important. With all of our gratitude, we raise our glass to your good health.